A few months shy of 3 years into the COVID-19 pandemic, Guyana is facing another global health challenge, referred to as monkeypox. While it is fortunate that monkeypox is rarely fatal when compared to COVID-19, Paul Chetty, a medical microbiologist, is adamant that as health authorities seek to contain the spread of this new virus, it is critical that the need of heightened public awareness be among the lessons learned from the country's struggle with COVID-19. An important weak point in the country's fight to combat COVID-19 from the onset was the lack of robust public awareness campaigns countrywide, which was further compounded by misinformation and myths about the disease. He insists that the health ministry should streamline its public awareness campaigns to target high-risk persons, including men who have sex with men, persons living with comorbidities, and the wider populace.
We talk about, mostly what we see on the newscast, we talk about the person who was infected and not necessarily about the methods of transmission. So continuing to talk about how this thing is being transmitted and what do we need to do to prevent ourselves from being transmitted. That should be our main message. Also, persons who live in their HIV community, educating them about monkeypox presentation. So what to look for in a partner who has some lesion or some type of presentation that seems somewhat abnormal.
Much of the precautionary measures endorsed during the onslaught of the COVID-19 pandemic are still relevant in keeping monkeypox at bay. Chetty expounded on the need for the sustenance of mask wearing and other personal hygiene practices.
There is some usefulness for continuing to wear masks, even though monkeypox is not necessarily like COVID. COVID tended to be spread by the very small droplets of saliva that we expel when we're speaking or sneezing. Monkeypox tends to be spread using the larger droplets. So ensuring that you wash your hands regularly, those things, so personal hygiene things will still be relevant.
While health authorities are working to ascertain the source of the monkeypox infection in Ghana, the chance that the virus was imported into the country has not been confirmed by the Ministry of Health. Taking into consideration that persons can start experiencing monkeypox-related symptoms some 21 days after becoming infected, Chetty shared that there is very little protocols that can be implemented at the local ports of entry to prevent imported cases.
It may be a situation where we need to go back to what we did for COVID, trying to understand if they were exposed, have them either in a quarantine period or observation period, where we're going to look at the patient the person for 21 days. And if they don't show any signs, then they're free to go about their daily life. But if they do, then we move to the next level. But unless we're doing that, it's probably going to be very difficult for us to keep it out.
He also suggested that health authorities strengthen virus surveillance and extending testing services to animals. The World Health Organization on July 23rd declared the escalating global monkeypox outbreak a public health emergency of international concern. The United States Centers for Disease Control and Prevention reports that there are in excess of 51,000 monkeypox cases in 92 countries. Timeka Rodney reporting for the HGP Nightly News.